The ICU that I'm in currently is a 12-bed capacity. The majority of the patients here are gunshot wounds, blast injuries. A lot of the injuries from the gunshot wounds are to the head. So it's obvious that they are being targeted when they go to these GHS sites to try to get food. Some of the injuries are also from the shoulder. The bullet enters at the shoulder, goes through the abdomen, and exits through the back, which means that they were laying on the ground. And were probably hiding from the shooting that was going on. The conditions in the hospital are not great. The staff is having to work with low access to equipment. Sometimes there's no gloves, sometimes there's no soap, sometimes there's no bandages. The staff are having to be ingenious and having to find ways to try to take care of their patients in the best way that they can. But the resources are just not there. Many of the patients also need specialized care, and many of the doctors that have the experience to take care of these patients are either overworked or there's just not enough of them. So the patients that should otherwise be surviving these situations or surviving these conditions are not, just because there is not enough people to take care of them. The nurses that are in the wards are working 24-hour shifts. Many of them are living in tents right alongside some of their patients' families. They also have low access to food. They have low access to water, and they don't get paid. And they're still coming into work. They're still doing these 24-hour shifts, and they're helping take care of their fellow Palestinians with the low resources that they have. 12-bed ICU used to be the only ICU in the hospital. It's expanded to a 50-bed ICU spread over multiple units just because of the number of severity of cases of patients that are coming in. Many patients that would have been in those wards as a medical ward or an internal medicine ward have been actually pushed out of the hospital into outdoor sections where they are being kept in tents under 95-degree heat. They don't have enough nurses to observe them, so a lot of times their care or their condition ends up deteriorating. And it's simply because there's not enough people to help take care of them. There's not the resources to take care of them. You have to speak up. One of the only ways that Israel is being affected is by public outcry from the international community.